Hi everyone, Dr. Hall here. We're going to start on Unit 12, which is just a little bit of a primer or a basic introduction to public health institutions so that you can get a sense of what are the organizations that are actually working in public health kind of at all levels of organization. So in this lecture, we're going to talk first about the role and the goals of public health, so a little flashback to the beginning of the course, then talk about the institutions that exist at global, federal, state, and local levels, and then also talk about the contributions of non-governmental organizations to public health. So let's remind ourselves of the role and some of the goals of public health. Right? So these are the goals of public health as stated by the American Public Health Association and the Public Health Service in the early 1990s. And so this is what they've said is kind of their mission. These are the reasons why they exist, right? So to prevent epidemics and the spread of disease, they've been very busy the past 2 years trying to do that. Protecting against environmental hazards, so just like we've just learned in the unit in environmental health and safety, as well as prevent injuries, which was also part of that unit. Promote and encourage healthy behaviors, so that's going to be getting at that non-communicable diseases, right? How do we prevent those? And then respond to disasters and assist communities in recovery. So we briefly touched on this in the environmental health and safety unit. And then ultimately to ensure the quality and accessibility of health services. It's kind of interesting because that's not really it's a little bit different from the other roles, right? It's like kind of looking and making sure that people have access to this other system, which is the health care system, as opposed to the public health system. So it's kind of interesting. So this should look familiar from the very beginning of the course. So according to the Institute of Medicine, right, these are the core functions. So those were our goals. How are we actually going to accomplish those goals? So what are the things that public health is going to do? So remember these 3 different tiers: assessment, policy, and assurance. So assessment is that collecting and analyzing information and then putting it into understandable and effective ways to communicate it, right? And then policy is then, okay, now that we know these things, what can we figure out about what's going to be a potential solution to these problems? What can we anticipate would be effective? What kind of recommendations can we make? And how might we implement them? And then assurance, right? Is it working? And are people getting what they need? So I like to think of these 3, as kind of what's going on, what's the situation, what are the problems, what can we do, and then is it working, right? So that's how I remember those 3. You might remember then that when we did the evidence-based approach to public health, we talked about the PERIE, P-E-R-I-E method. And this is really just breaking out those 3 things into 5. So what is the problem, what's going on, is problem and etiology. So you might recall that etiology is determining the cause, looking for those group associations via examining the distribution of disease, and then the different types of studies to demonstrate causation, that something is likely a contributory cause. And then we're going to figure out what to do about it, right? So that's both recommendations and implementation. So what do we think would work and how can we do it? And then, of course, assessment would be the evaluation piece. So different frameworks, it's all talking about the same thing. The last framework, again, talking about the same thing, and they've even given you the assessment, policy development, and assurance, the big 3 around these, and this should look familiar as well, right? So monitoring health, diagnosing, investigating, that's the P and the E, right? Then inform, educate, and empower. That's going to be part of the recommendations, as well as mobilizing partnerships and developing policies. That's going to be implementation, and enforce laws is going to be implementation. And then link to or provide care is part of implementation as well. Assure a competent workforce, evaluate, and then the one that we haven't really talked about thus far is research. So at the core of all of this, so through this entire process, you're doing research to figure out what's going on, what's potentially going to work, what does the data say. But this is a kind of big overarching activity that's going to happen in public health agencies. It's super important that we're making well-informed decisions based on what's been demonstrated to be true or what's been demonstrated to work. So when we think about all the different institutions that are involved in public health, it's a myriad, it's a ton. So at the governmental level, we have local, state, federal, and then kind of global organizations. But of course, our healthcare system is deeply involved in public health through prevention and screening measures. So there's a lot of crossover and overlap there. Other government agencies also. So the Centers for Medicaid and Medicare Services is not technically a public health agency, but by meeting the healthcare insurance needs of a sizable segment of the population, they are helping improve public health by improving that access to health care. Remember, when we think about the determinants of health, that was like 25%. So that's an example. Housing authorities that provide low-income housing for people, or nutrition programs, schools, educational institutions are all going to be involved in this as well. And then finally, down at the bottom, we've got community and private organizations. And those are those non-governmental organizations that we're going to also touch upon today. So if we think what's going on globally, right? What's in charge of kind of the whole planet? One is the World Health Organization. So the World Health Organization is the huge organization that it's a sub office of the United Nations, and it's kind of tasked with all of the public health for the whole planet, so that, assessment and policy and evaluation, like how are we doing, what's going on, what should we be doing, what might help, is it helping? And so the World Health Organization is broken into multiple different divisions, each responsible for a different part of the globe, and they try to help monitor and coordinate responses to public health emergencies such as the COVID-19 pandemic. So they've been very involved with COVID-19. Here in the United States, we don't see that quite as much because we have kind of a big powerhouse of an organization here within our country, the CDC. So that tends to be what we see for the most part. But in other parts of the world where they don't have such strong public health institutions within their nations, the WHO is going to be a big presence. Then there are lots of other programs and organizations. So UNICEF is another program within the UN, and it really focuses on immunizations for children. UNAIDS is another organization within the UN, obviously focusing on the HIV/AIDS epidemic, and that's a partnership between a whole bunch of different agencies, including the World Bank. So you might not think of the World Bank as a public health institution, but in fact, they fund a very large proportion of public health programs and interventions in multiple nations throughout the world. World Bank is in many ways focused on economic development, and of course you cannot really foster economic development if people are sick or dying. So public health has actually become a really important piece of economic development. So they do a lot of funding. And then another big organization is USAID, or USAID. And so this is money and programs that the United States funds and runs in many other countries to improve public health. You might say, well, why are we doing programs in other countries? And to simplify it, there are two main reasons. One is that, as we've seen with communicable diseases, something that crops up in a country halfway across the world can end up having big implications for us here in the United States. Now, in the instance of COVID-19, we can't say, because we had boots on the ground, we were able to squelch an epidemic before it became a pandemic. No, that didn't work with COVID-19, but it has worked with many other infectious diseases. So Ebola has never really gotten a foothold here in the United States, in large part due to our our efforts in other parts of the world to combat it. The first SARS virus never really got a foothold here, in large part because we were helping to control it. So there's lots of things that we do that help protect the health of Americans by being involved in global health. But the second reason is that it's a form of soft diplomacy, of soft power or diplomacy. So you'll notice this tagline here, from the American people. So if you have studied at all global politics, influence is really important, and there are lots of different ways that you can get influence. One is through military might. Another is through economic might. Yes, we have those things as a country, but another is through humanitarian efforts, the good that you do for other people, for other nations, and the relationships that you build with them. And that can be a much nicer way, actually, to develop influence and foster communication and collaboration with other nations. So we actually do have a sizable aid programs for public health in other countries. This is an example of what that looks like. So let me orient you to this graphic. I might need my glasses. It's tiny. Okay. And I'm over 40, as you know. Okay. So the United States is down here. So we contribute about $96 billion in aid for health assistance programs globally, right? So not for the United States, but for other countries in the world. Most of that we then administer through USAID. Some of it we give to UN, right? Very small, this little bit here. We also give some to some other non-governmental organizations, right? We donate, and some to Global Fund, right? So we give to lots of different things. Many of them we control ourselves. And then you can see that most of the efforts are in sub-Saharan Africa and some global initiatives. That's where most of the US money goes. But I want to point out here, because it's going to come up again later, private philanthropy, right? So these are rich people that just decide to give money for things, is a sizable part of where global public health funding comes from. BMGF is the Bill and Melinda Gates Foundation, right? So $15.9 billion over the time period measured in this particular study. And then, other governments, and then some of the big ones here in terms of some of our other wealthy industrialized nations. You might wonder, where is China on here? China does give funding to other agencies, but it's an order of magnitude smaller. So it's about $50 to $100 million a year currently. This is not a type of program that China invests in. China invests very heavily in economic developmental programs, and particularly in economic loan programs. So it's a very different strategy. Okay. Let's talk about here within our own country. So public health institutions at the federal level, so for the entire United States. So, of course, let's remember that the Constitution established the three branches of government: the legislative, which is Congress, the executive, which is the White House, and judicial, which is the Supreme Court, and then all of those other courts that are underneath it. Remember that the legislature's job is to write legislative statutes. So that's our legislative statute form of law. The executive branch, through rules, regulations, and administrative regulations, can do administrative law or administrative rules. And then the judicial system can result in law through case law or judicial law. Right? So in 1944, U.S. Congress passed the Public Health Service Act, which then resulted in the creation of the Department of Health and Human Services within the executive branch. So remember, the executive branch's job is to carry out the work of the government in accordance with the laws and the statutes passed by Congress. So Congress said, okay, we need a public health service organization. And so the executive branch said, okay, so I'm going to make a Department of Health and Human Services. So that department, right, is one of many departments in the executive branch. So you may remember this from the law and policy lecture. So departments of transportation, agriculture, education, and so many more. So the Department of Health and Human Services, or HHS, is under the executive branch. So under Health and Human Services, right? So Health and Human Services is under the executive branch of the White House. And within the Department of Health and Human Services, there are many organizations that are responsible for public health. So the big one that you're probably really well familiar with right now is the CDC, Centers for Disease Control and Prevention. You're probably also familiar with or have heard of the National Institutes of Health. So now the CDC is the premier public health agency for the United States, and it's the premier public health agency pretty much in the world. So it does all of the things of public health that we've been talking about this entire course. It evaluates the problem, it collects data, it analyzes data, it researches potential solutions, comes up with recommendations, implements things in different types of programs, and does assessments. So CDC is a huge powerhouse for public health efforts in our country. The National Institutes of Health is a research organization, and primarily they do biomedical research. So whereas the CDC will do epidemiologic studies and look at outcome studies of different treatment regimens, in large part the NIH is working with developing, sometimes understanding the mechanisms of disease, like what are the genetic findings of people who are more likely to develop diabetes versus those who are not, and can we do gene therapy, and what's the best way to develop a new drug to treat this type of arthritis. So those are the things that happen primarily at the NIH. So it's primarily biomedical research. It's not primarily public health research. That's primarily done by CDC. You're probably also familiar with the FDA, the Food and Drug Administration. We're going to talk about that in our next unit, more in depth, right? So they're regulating and overseeing the safety of foods and drugs. You might be less familiar with the Indian Health Service. So interestingly, as part of some of our treaty organizations and things, treaty agreements, we have an Indian Health Services which provides both public health service and direct care health services, so direct provision of medical care to American Indian, Native American tribes in our country, and that is a huge topic we could talk about for a long time. Within CDC, there is also the Agency for Toxic Substances and Disease Registry. So they keep track of basically chemicals and things that can harm you, and they help advise EPA on like what limits should we have for benzene, right? So they would advise the Environmental Protection Agency on how much benzene can there be in drinking water, or advise OSHA, the Occupational Safety and Health Administration, on how much benzene is it okay for workers to be exposed to on the job. So they're kind of a subdivision within CDC. You've probably never heard of Health Resources and Services Administration. Their job is to try to ensure that we have health equity in this country. So they have a big job because we are far from it. The Agency for Healthcare Research and Quality is one of my favorites because they really look at what is the most effective way to appropriately care for people, and are we doing a good job. So one of the things that they do is what's called the U.S. Preventive Services Task Force. They look at all the data on screening recommendations, for example. And so their statement paper on screening mammography is really interesting, and actually some of the data that we used for our activity looking at positive predictive value and negative predictive value of screening mammography at different ages came from their research and their data analysis. So I love them. They really help clinical providers know what is the best thing to be doing for their patients. We also have the Substance Abuse and Mental Health Services Administration, and they do some really great work around advocating for resources and doing some public health education. And then I've kind of put grade in here, Center for Medicare and Medicaid Services. So they are not a public health agency, but they are under HHS. And of course, everything that they do has a huge impact on public health because they are providing health insurance to a sizable portion of the population. So these agencies are all under HHS, which is under the executive branch of the government at the federal level. Now, I'm going to point out that NIH by far has more funding than any of these other agencies. In fact, NIH has more funding than any of these agencies, with the exclusion of CMS, combined. So the public health agencies, it has the biggest budget. And so I just need to editorialize for a little bit here and kind of point out that in the United States, we tend to be really interested in the flashy things. So we like medicine, we like technology, we like research into new drugs and exciting treatments. And so we tend to fund those things very heavily. Public health, we tend to fund a little bit less. So if you look, for example, at the proposed 2022 budgets, so the NIH, the National Institute of Health, which does biomedical research, over $50 billion. Not that it's not necessarily well spent. We get a lot of good return on investment from NIH, although I could quibble with that. But CDC and the ETSDR together, less than 10 billion. So, and what's interesting is that the total funding there for CDC, that's been flat for over a decade. So it's kind of interesting to think about. And when you really think about public health and why it's sometimes kind of the poor cousin of flashier things like medicine and biomedical research, it really comes down to the fact that I love this, Dr. Gerald says, one of the real challenges with public health is when it works, nothing happens, right? So public health is all about prevention and keeping people healthy and preventing disease and illness and injury and stopping epidemics in their tracks. So when public health works, nothing happens. And so it's really hard sometimes to say, but like, no, it was really worth spending all of that money and all of that effort, right? Because you can never entirely prove the fact that things got better was because of your intervention and that they weren't necessarily going to get better just on their own, right? So these are complicated issues. There are so many factors involved, right? So, he's like, everyone looks at you and goes, why did we do this? It's because this was so that nothing would happen. So it's tough in public health, actually, to justify and advocate for resources when you don't have anything to show for it, so to speak. Okay, so we've talked about global and federal levels for governmental public health agencies. Let's talk about state and local level. So the authority for this comes from state statutes, state legislative statutes for the most part. So it's going to vary a lot from state to state in terms of what are the responsibilities of the state public health department, what kind of funding do they have, what their mandates are. And then when it gets down to the local health department, then that can vary greatly too. So in some states, the local health departments are really just kind of branch offices of the state health department, and they just kind of tailor everything to the local region. But in other states, such as Wisconsin, actually, the local health departments, which for us are based on the county, they're funded by the county, they're administered by the county, and the county says what they have to do and what they don't have to do. And they don't get a ton of support from the state. So they have a lot of autonomy. They're very responsive to the local community, but they don't have a lot of support from the state. So I have to say, I'm on the Board of Health and Human Services for Dunn County, and one of the frustrations that I have with our current system is that there's a lot of reinventing the wheel that happens at every single local county health department, which if you have a different set of needs from other counties makes a lot of sense. But when we're dealing with a global pandemic, is really unfortunate, right? So there are lots of opportunities where we could maybe, combine forces and be more efficient, that there just isn't the mechanism to do that. So state and local health departments in general, their jobs are going to be as follows. So they're going to do especially at the local level. So immunizations for people who can't get it through private insurance or a local doctor's office for whatever reason. So immunizations are a big part of what our local county health department does. Communicable disease surveillance is a huge part, right? An initial investigation of outbreaks. So our poor county has been working tirelessly for the last 2 years. All the contact tracing and outbreak investigations have been happening through them. And they're a small office, so it's been a big challenge. Communicable disease control. So this includes everything from quarantine and isolation and enforcement thereof to, mask mandates and things like, so Dane County, for example, has a mask mandate. Dunn County doesn't. And it also includes things like screening for and treating communicable diseases. So tuberculosis and syphilis are important historical examples, and so usually a lot of health departments have a mandate that they have to kind of help control those things. But our local county health department is very involved in contact tracing and assuring appropriate treatment and testing for all types of sexually transmitted infections, right? Because we have those reportable diseases that you might remember. Inspection and licensing of restaurants. So you can feel confident when you go to Silver Dollar or Logjam that you are very unlikely to get food poisoning there, because they have to follow all of the recommended food safety procedures and be inspected regularly. I'll never forget, I used to live in New York City, and one time I was sitting in this pub and I was eating with a friend, and then wouldn't you know it, this big rat runs out of the kitchen, runs across the room and right out the door, because it was like summer, so the door was open. And I was like, oh my gosh, right? But we don't generally have that, right? If you have regular inspections, sometimes what can you do? A rat comes in off the street. But anyway. Environmental health surveillance. So again, checking, what's going on in the community. Our local health department is involved. If you think, so we had a dog die actually this summer or fall, due most likely to blue-green algae exposure in our lake. The county is involved in that, right? And in responding to that, making sure that our water is safe, making sure that our air quality is sufficient, all of those things. Coordinating screening programs. This is a lot of what our local county health department does, making sure that infants are getting the appropriate screening that they need, particularly lead screening for those children who are at high risk. And they also then do the site investigations and interventions if a child is found to have an elevated blood lead level. Tobacco control programs are often a part of many state health departments, public health departments, and sometimes local as well. And then preparedness and disaster response. So being ready in case of a mass casualty event, in case of flooding or a wildfire or whatever the conditions in your particular region may be. So these are really common duties of local and state health departments. So lastly, I'm just going to touch on non-governmental health organizations or agencies. So it should say organizations. So if you hear NGO, that's what they're talking about, non-governmental organizations, NGOs. So what are the ones that are involved with health? There are quite a lot, actually. I should have animated these, but here we go. So many of them actually directly provide public health or health services. And we're really lucky that they do, right? So, for example, Red Cross and Red Crescent, or as we know it in the United States, the American Red Cross, provides ton of disaster relief, right? So when there's a tornado or a flood, they go in and they're providing shelter, they're providing food and water, they're providing blankets. So they are there helping respond to disasters. They also, as you may well know, are responsible for the vast majority of our blood supply for transfusion in the United States. So they run blood drives routinely. You can donate blood at their offices. And in fact, there's a shortage right now because not a lot of blood drives have been happening due to the pandemic. And our hospitals rely on the Red Cross doing this, right? So we're so fortunate that they do it and that they do it as well as they do, because that's where most of our national blood supply comes from. The Bill and Melinda Gates Foundation, as I mentioned earlier, is very active actually in many countries, especially in malaria eradication efforts. So they distribute bed nets, they help distribute medication, they do educational programs. They do an incredible number of programs to reduce the burden of communicable diseases in developing nations. I just find it really interesting. There's no big Bezos Foundation or Elon Musk Foundation. I think they're too busy building spaceships, right? The Robert Wood Johnson Foundation is also very active in a lot of public health realms. They're not quite so much directly providing services as they are doing research and developing policy recommendations. So that's kind of this next group here. And there's lots of different types of organizations. They're kind of really professional type organizations like the American Heart Association, American Lung Association, American Cancer Society, that have a lot of medical and health professionals in their boards and in their membership. And they do a lot of kind of scientific and medical work, but they also do a lot of policy recommendation and advocacy. They also, the American Heart Association is what runs, your basic life support, your CPR training courses, and they have that whole certification process. So as a physician, when I needed to learn advanced cardiac life support to learn what to do when somebody in the ICU has a cardiac arrest, I took classes from the American Heart Association, right? So the training programs are really a huge part of how we get good healthcare in this country, interestingly. Then there are other things, kind of more grassroots foundations. So Mothers Against Drunk Driving kind of came into being during my youth and teenage years and was actually really instrumental in getting DUI laws passed. Previous to that, there was just a spotty patchwork, and it often was not illegal to drive impaired in many states, and a lot of kids were dying. And so they formed, it's just a grassroots organization. They got really involved in advocacy and policy recommendations. Similarly, ACT UP was a group that formed in response to the HIV/AIDS epidemic. At that time, very little attention was paid to the epidemic by the public health agencies and the healthcare systems of the day. The government was not paying attention to it. There was no funding really directed toward research or management. And so ACT UP was one of the many grassroots organizations that formed to say, hey, we need to do something about this. Similarly, Susan G. Komen, you may be well familiar with, they have done a lot to raise awareness about breast cancer. They have lots of events and campaigns, and they raise a lot of money for research, primarily for breast cancer treatment. Not quite so much prevention, but treatment. So these are just some examples. There are lots of other non-governmental organizations that are involved with public health, and they serve a really important role, and they're very impactful. So for public health institutions then, we talked about the role and goals of public health, a nice review of some things from the beginning of the course, and then talked about global institutions and then our governmental institutions at the federal, state, and local levels and what some of their responsibilities are. You'll have an activity for this unit that encourages you to explore that a little bit in more detail. And then we talked about the important role that non-governmental organizations serve and how much they actually contribute to support public health. So that's it for today. Thanks.